Welcome to GN10, a bite-sized podcast brought to you by the International Society of Glomerular Disease. Our hosts are nephrologists and glomerular disease experts, Dr. Kanara Jabari of Northwell Health and Hofstra University on Long Island, New York, and Dr. Koil Jain from the University of North Carolina, Chapel Hill. So, welcome everybody. I'm so excited to welcome you to our ISGD podcast, also known as glomerulonephritis or GN10. I am Koil Jain from the University of North Carolina, and I have with us a very special guest. This is our very first podcast with the International Society of Glomerular Disease. And through these short podcasts, we're hoping to connect you with the leaders in glomerular diseases and provide updates on not only glomerular diseases, but also in research and clinical trials and how you can get involved. And we are hoping that you would be part of this journey with us.
And Koil forgot nicely her co-host, Kanara Jabari from Northwell. It's so typical of Koil to do that.
Before we introduce our very special guest, there is somebody that is making this happen. Her name is Laurel Damashek, and she is the executive director of ISGD and the producer of this podcast. It wouldn't be possible without her.
Totally. Welcome, Tobias, or Toby, like he likes to be called in the US, Uber, who is our current president and the founding president of the ISGD. Welcome, and we'll start off with just tell us about yourselves and how you got involved with ISGD.
Thanks, Kyle. Thanks, Kenneth. I'm at the Hamburg Medical University Center in Hamburg-Eppendorf, one of the largest university medical centers in Europe, around 2,000 beds and 15,000 employees. And it was actually the first fully digitalized hospital in Europe. There I'm acting as the chair of the Center of Internal Medicine, and I'm directing the third department of medicine, which is nephrology, transplantation, rheumatology, and endocrinology. My research interest has been for the last 25 years glomerular biology and glomerular disease. And with that, I've been part of a podocyte community from its beginning. When we hosted the 10th International Podocyte Meeting in Freiburg 2014, we came up with a broader title for the podocyte meeting. We called it From Glomerular Biology to Glomerular Medicine. At this time, the meeting was co-hosted and fully operated by NephCure. We started a discussion how we could get glomerular medicine or officially formalized. And then it was really Josh Tarnow from NephCure the last 2 years who pushed the idea of an independent society. And it was Josh flying out 1 year ago to visit me in Hamburg, asking me whether I would like to join the team and to eventually become the inaugural president of a society. And here we are.
This is so super exciting. And I will say, Kinar and I have been really glad, but also humbled by this opportunity to work with you all. And we have such an amazing cast of people, if I may say so.
Thank you for mentioning me this time.
Thank you so much, Toby, for your introduction and also for how ISGD really came about. We've always had glomerular diseases and glomerular disease specialists for a while. Then why was there a need for ISGD now? Why not a year ago? Why not later?
The impact that GD specialists can make on their patients has never been bigger than today, than now, with new targets, new therapies, new biomarkers, and new trials coming around the corner every other week. So this really calls now for professionalizing our network, for putting forward standards for GD centers, for GD fellowships, for joining forces, and for really synchronizing in trial recruitment and patient matching. Of course, there are many strong programs in place already, and ISGD is not replacing the programs, but rather building on these programs, connecting the existing strong programs. And these programs that are already in place will serve as blueprint for the nucleation of new centers around the globe.
So Koil and Toby really just coined the term right now, GD. We used to call GN, but I guess glomerular disease fits better with all this nomenclature change that's happening in nephrology. But let's not focus on the nomenclature. Toby, one of the questions I had was, what is the role of ISGD where already there are other societies like ASN, ERA, ISN, KDIGO guidelines, GlomCon? So what does ISGD bring to the table?
Yeah, this is a question, of course, that has been trying ourselves and all our committees and members. So ISGD will not duplicate efforts being done by other societies. We see our role rather in connecting the pieces that are already there, in professionalizing and standardizing the programs to develop and filling the gaps that are not in place yet. And we should mention there is no competition with the other societies. In contrast, most of our members of the steering committee are in leadership roles in the other societies. So this is really a joint and friendly effort. And most other societies have been very forthcoming to support us in our development. Now, what does it mean not to duplicate? It really means that we are becoming a central hub, gathering experts and professionals from all different fields, including the pharma field, the medical field, but also patient interests, that we connect the pieces and resources that are already in place, and that we help and drive the individual enterprises in each place.
And how do you think that ISGD will get the global community together? So, not just the societies, but the people, the patients.
So I think it will be at least on 4 levels. So the first level is really what I just mentioned. We will be a central hub and gathering place for resources, for tools, for gateways, for patient to trial matching, building up this kind of virtual world. And as we speak, we are building up the website and the applications and all the new tools that we develop that soon will be available for our members. Number 2 will be, of course, the channels via social media, the podcast as we do it right now. Number 3 will be the annual or biannual meetings. And the first meeting will be in June 2025. This will be a joint meeting of the Podocyte meeting and the first inaugural ISGD meeting. It will take place in Hamburg and be the main gathering place for experts around the globe coming together, exchanging the experiences, helping to build up programs and the future of glomerular medicine. And fourth, it will really be our networks, also informal networks that started meeting at all other big society meetings.
So before I go on to some more serious questions, let me ask you, what is your favorite glomerular disease and why?
Yeah, favorite is an interesting term, but basically the main research interest has been podocytopathies, so membranous nephropathy, minimal change in FSGS. And I think while we made a lot of progress in membranous nephropathy over the last 15 years, there's still a lot to discover in minimal change disease and FSGS. We probably will reclassify these diseases. We will probably understand that this is a continuum between the two diseases. We will probably understand the factors driving the diseases. So this is something that is really driving me and our team at the moment. And hopefully ISGD can contribute to a much better understanding and reclassification of a disease in the near future.
Okay, you sound really passionate about glomerular diseases, which I completely agree with. This is how Kinar and I feel as well. But what else are you passionate about besides medicine? What really drives you?
It's an interesting thing with passion. I think I learned that passion is a personality trait. So who's passionate in work is also passionate in private life. It's really true.
Yeah.
And this means for me personally being very passionate about outdoor activities, hiking, friends, family, sport, and history, and just general curiosity in understanding what's happening around us.
That's great, Toby. So the question then is, what is the future of this society and where do you see in the next 5 years?
It will be a sustainable network for professionals, for healthcare providers, the meeting point of everybody to come together, to elaborate glomerular medicine, to drive glomerular fellowship programs, to drive education, and at the end, to improve patient outcome.
We've talked about ISGD at length and we've asked you all these questions, but what do you want people to know?
I want them to share our enthusiasm for ISGD, to join our enterprise. As we speak, we have over 700 members from almost 60 countries, from 6 continents. Join us, help to shape our mission, develop our programs, and be part of an improved glomerular disease medicine. Let's move from glomerular diseases to glomerular health. And we would enjoy it uttermostly if you would be part of this.
Thank you, Toby, for being with us and spending time with us. And I've really enjoyed having you. And I'm purposefully forgetting Kenar again.
Thanks you, Toby, and thank you, Coyle, for forgetting again. But we're signing off from GN in 10, and we'll see you again in the next podcast.
This has been GN in 10 from the International Society of Glomerular Disease. You can listen and subscribe wherever podcasts are found, and tweet at us at ISGD Tweets. Thank you for joining us.